Hi, my name is Tiffany. I'm representing Team C, and this presentation will be about mental health illness in adults with substance abuse. Let's get started. Assessment. Adults are typically the target population since they are the largest population that is involved with the abuse of drugs and substances. Adults fall within the category of 18 years and above. The abuse of substances by the adult population has had a direct impact on their mental well-being. Adults who have had abused drugs and substances have been found to be associated with a given type of mental illness. Luckily, some of these types of mental illnesses that adults suffer from are diagnosable and can be treated, especially if medical assistance is acquired during the early stages. Risk factors. The abuse of drugs and subsequent results of mental illness is faced by various challenging factors and aspects. These risk factors that face adults with mental illnesses due to substance abuse include failure to seek medical attention and assistance by adults suffering from poor mental health is one of the greatest risk factors. Many individuals suffering from various mental illnesses rarely seek medical assistance and attention. This makes the poor mental status among adults much poorer. Failure to seek medical attention also makes it a big challenge for the mental disorder to be treated effectively, and the cost of the treatment also increases. Lack of identification that one is suffering from a given mental illness is another risk factor. Many adults with substance abuse are less likely to realize they are suffering from a mental problem in order to seek medical attention. Existing policies. Since the mid 80s, the United States has pursued aggressive law enforcement strategies to curtail the use and distribution of illegal drugs. Not only do illegal drugs promote illegal activities, they also alter one's mental state. The long term effects of illegal and abused prescription drugs can lead serious mental health problems like depression, anxiety, schizophrenia, and bipolar disorder. Policy development actions. There has been measures and guidelines that are followed in the provision of education to the physicians on the appropriate drug prescription procedures. Physicians are regularly giving education on the most appropriate practices that they should adopt in prescribing drugs and medications to avoid their later misuse and abuse by patients. The formulation of programs in order to prevent the abuse and subsequent addiction to drugs, an aspect that causes mental illnesses, is one of the steps that has been taken with the objective of curbing the ever growing drug problem and challenge in the society. The formulation and subsequent formulation of the more stringent laws and regulations to govern the subscription of drugs is one of the most effective strategies of curbing and solving this problem. Many of the substances abused are prescription, which do not follow protocol and which end up being misused for the wrong reasons, that is, being abused. The development of measures that ensure that drug manufacturers are accountable of this drug they manufacture will play a key and landmark role in the prevention of the challenge of adults with mental illnesses due to substance abuse. Facilitators. The coalition is a drug-free Cincinnati. The coalition is a drug-free Cincinnati is one of the many organizations in Ohio that offers help to adults suffering from substance abuse. The coalition has identified drinking, marijuana, and use of prescription over-the-counter drug misuse as a primary substance abuse problem among young adults. Strategies are designed to change social acceptability, access, availability, media messaging, promotion, and policy enforcement to create a more supportive and thriving environment for young adults. Assurance activities. The provision of relevant education and subsequent enlightenment of the members of the society with regards to the issue of drug and substance abuse is one of the key assurance activities. This is expected to reduce the number of individuals engaging themselves in drug abuse activities, an aspect and a key cause of mental illness. Everyone in the population is vulnerable and is likely to abuse drugs, and therefore the enlightenment of the members of the general public is irrespective of the age of the individual, and the most important to enlighten on the issue of the parents. Assurance activities continue. The development of programs that integrate and involve or allow for the direct participation of the general public in campaigning against poor mental health as a result of substance abuse is one of the most effective assurance activities. Through the engagement of the members of the public, awareness with regards to the issue is raised, and this is likely and is expected to have a great impact in reducing cases of mental illness in adults with substance abuse. The evaluation of whether the health facilities available to help with the recovery of individuals with mental illness as a result of substance abuse is another key assurance activity. The evaluation of the capability of the available facilities to handle patients with mental illness and that is caused with substance abuse would help determine whether there is accessibility or not. Linkage. Linkage is ultimately a key part in helping people with substance abuse and mental health issues. The Ohio Department of Mental Health and Addiction Services helps you find the assistance you need by maintaining a list of provider agencies throughout the state. Therefore, people with substance abuse and mental illness issues can find the necessary resources they need to live a healthy life. Over the last decade, there was a significant increase in the number and proportion of the mentally ill in our nation's jails and prisons, with 2005 Bureau of Justice estimates reporting that 64% of those in prison locally and 56% of those in prison by the state had indications of symptoms of mental illness. Policymakers have promoted mental health courts (MHC) as a solution to stop the criminalization of the mentally ill. The first Ohio mental health court began in 2001 in Akron and recently was designated one of 5 Bureau of Justice assisted mental health court learning sites. The offenses bringing the person to the attention of the MHC are misdemeanors or lower level felonies. The person must voluntarily agree to the 2-year program monitoring of participants and their adherence to court conditions by the judge, and treatment team is reinforced by graduated rewards and sanctions with treatment modified as necessary to promote recovery as well as public safety. As a result to the program, patrons were able to get help with substance abuse related issues. Those who successfully completed MAC experienced fewer incarcerations after the program participation when compared to their previous behavior and in comparison to other consumers of mental health services. We conclude that this indicates that the program has had the desired effects in slowing the revolving door of criminalization. In conclusion, mental health illness in adults with substance abuse is relatively a growing challenge in the society. There has been various policies that have been developed and formulated with the objective of countering this challenge in the society. The laws that have been passed in order to handle this challenge have been relatively effective and have created an impact positively. However, much still needs to be done in terms of legislation to counter the challenge. The creation of more institutions to cater and handle this increasingly growing challenge in the society and training adequate personnel who can be capable of helping address those who are already suffering from the challenge will go a long way into helping resolve this challenge. Thank you.